As a psychiatrist, it's very common for me to see co-occurring disorders. A co-occurring disorder means that you have a substance use disorder and another psychiatric disorder on top of it. The most common disorders that I see are really depression, anxiety, and now with anxiety is post-traumatic stress. I would say those are the three largest mental health disorders. The data would show that someone who has any substance use disorder, approximately 40% have a co-occurring mental health disorder. The data would show on the other side, if someone has depression, anxiety, about 20% would have a substance use disorder. So the two are really tightly interwoven, and you have to treat them both together. It's a common question I get from individuals like, well, when are you going to treat my anxiety, doc? And it's like, well, we have to get you through detox first, and then we'll look at your anxiety. Or when are you going to treat my depression? I said, again, you've got to get through detox first. Most of my patients who are going through withdrawal symptoms are depressed and anxious. It's just part of the disease. You know, as that dopamine's readjusting in the brain, and it's more than just dopamine, the other neurotransmitters. It takes time to heal that. What I see, unfortunately, is that if we do not treat the depression, the anxiety, the trauma, the chance of recovery are very slim. And so, but on the other side is, since depression and anxiety are so common in withdrawal, do I treat that, or do I just let it ride for a while and see what the brain does when it heals? It can take up to a year for alcohol use disorder, you know, for the brain to really heal. If it's clean and sobered for a year, it's a long time. And so what am I treating? You know, all of us are so responsive to our environment, to our food, to exercise, etc. And think about going through alcohol or opioid use disorder treatment. In addition, there's all the psychosocial factors that have taken place. You may have lost your job, your significant other, your kids. I mean, it's huge. And does all that need treatment with a pill? Certainly not. I try to get people off of pills. You know, I'm a psychiatrist. I'm trying to put myself out of business from prescribing medication. But sometimes you just need it, and it really depends on what's going on. I think that evidence would show that appropriate therapies for the appropriate disease are even more effective than medication. And so we really try to limit the amount of antidepressants, anti-anxiety agents that we prescribe. Certainly nothing that would be addicting or habit-forming. But sadly, my patients have discovered that they can misuse most every drug that I prescribe. You know, they're mood-altering, my medications. I mean, I'm treating depression, I'm treating anxiety. Heroin, alcohol, cocaine are naturally mood-altering. And the way they adjust the mood, affect the mood is so much more significant than what my medications do. However, mine are very effective as well, and actually cause much more stabilization of a mood. They can cause reduction of anxiety without being addicting, can improve sleep without being addicting, can certainly improve mood without being addicting, and much more longer acting effects than, say, cocaine or alcohol would have.